Good afternoon, Namaste, Marhaba, Adab, Salam. I am Dr. Kritika Upadhyay, working as demonstrator at Department of Community Medicine and School of Public Health, Postgraduate Institute of Medical Education and Research, Chandigarh. I am the host of this program and coordinator. On behalf of PGIMER Chandigarh, I welcome our esteemed participants and experts to this 2-hour panel discussion on managing COVID-19 pandemic experience and best practices of India under the umbrella of International Public Health Management Development Program. The program has been initiated as a follow-up of Honorable Prime Minister Shri Narendra Modi video conference with SAARC countries and is offered to assist them. The program aims at demonstrating the best and replicable practices and experiences of India in managing COVID-19. It is a privilege that Ministry of External Affairs, Government of India has supported Department of Community Medicine and School of Public Health, PGIMER Chandigarh, for hosting this event. It is an opportune time to expand our professional network and discuss problem of mutual interest with delegates from member countries of Indian Technical and Economic Cooperation. In coming 2 hours, you will hear experts of the country on COVID pandemic, its management, and learn strategies to implement in your own country. You all are excited for the panel. Not taking much of time, I invite Professor Jagat Ram, Director, PGIMER, to deliver the welcome address to our global participants and experts. We welcome you, sir. He is currently Director of PGIMER and completed 40 years in Institute. He has conferred Padam Shri Award by the President of India in 2019 for exemplary work in the field of ophthalmology. Along with Oscar of Pediatric Ophthalmology at the World Congress of Pediatric Ophthalmology and Starbasium in Barcelona. He is the recipient of Best winner for a new surgical technique on management of double crystalline lens at the American Society Cataract and Refractive. We welcome you, sir.
Dear ITEC participant and eminent expert, a good afternoon.
Good afternoon.
On behalf of PGI Chandigarh, I welcome all of you to this wonderful program, Managing COVID-19 Pandemic Experience and Best Practices of India, being conducted by the Department of Community Medicine and School of Public Health, supported by Indian Technical and Economic Cooperation, Ministry of External Affairs, Government of India. This program has been conceived as a follow-up of Honorable Prime Minister Shri Narendra Modi ji video conferencing with the SAARC countries, and he is offered to assist them in managing COVID-19. I take this privilege to welcome expert Professor V.K. Paul, Member Niti Aayog, and Chair of the COVID Empowered Committee of India, Professor Randeep Guleria, Director, AIMS New Delhi, New Delhi, Madam Vinny Mahajan, Additional Chief Secretary, Department of Housing and Urban Development, Government of Punjab, Dr. Harshad Thakur, Director, NIHFW, Dr. Sujit Singh, Director, NCDC, Dr. A.M. Kadri, Secretary General, Indian Association of Preventive and Social Medicine, Dr. Sangha Mitra Ghosh, Secretary General, Indian Public Health Association, Dr. K.K. Yadav, Principal Commissioner, Chandigarh, Mr. Mangal Pandey, Health Minister, Government of Bihar, and last but not the least, our favorite Dr. H.R. Nagendra, President of BIASA. who has kindly consented to be part of this coveted flagship program. All these experts are intensively involved in managing the corona pandemic in India. Under the same umbrella, Ministry of External Affairs has bestowed us the responsibility of conducting this online course on managing COVID-19 pandemic in 3 phases. In the first 2 phases, 130 middle and senior healthcare professionals from countries of SAARC, Southeast Asia, West and East Africa, Caribbean island, and South America region were trained. The program successfully demonstrated the best and replicable practices and experience of India in managing COVID-19 pandemic through the eminent faculty of PGIMER Chandigarh and administrative expert. The third phase envisages learning of the healthcare administrator and decision maker of the 161 ITEC countries from experience of eminent expert of India in making sound decision in tackling the COVID-19 pandemic for the country. As you are all aware, COVID-19 is a novel coronavirus infection which started from Wuhan in December 19. Now it has become pandemic and has involved all the countries of the world. Every country is working hard to tackle this coronavirus. In a similar fashion, we have efficient team at PGIMER Chandigarh, which is an institute of national importance. Our institute is pioneering and practicing good practices in the hospital and field setting. All the departments are working.
So they might have some funding, but not full funding. So
Pandemic. We have started the dedicated COVID hospital, which is 200 bedded hospital, and our virology lab is working day and night. And we are also mentoring the institute in real-time PCR and gene expert. We are confident to fight and win the war against COVID-19. I hope this present panel hosted for healthcare administrator and decision makers of 161 ITEC countries will pave the way for participating countries in effectively managing corona situation in their respective countries. I thank all the technical expert and decision makers for sparing time for this vital event to discuss and share the best practices of India so that the participant can adapt and adopt services based on their setting. Lastly, I congratulate Department of Community Medicine, School of Public Health, especially Dr. Sonu Goyal, Program Director of this event, along with his team, for coordinating with the eminent speakers of India for this important panel discussion. I wish you all the best. Thank you very much.
Thank you very much, sir. Thank you very much, sir, for giving time. And I definitely hope your blessings that this panel discussion will be a success. So I request now that Dr. Sonu Goyal, Program Director, ITEC MDP, to welcome the audience and share the program overview. Dr. Sonu Goyal is Professor in Department of Community Medicine and School of Public Health. He has an experience of 17 years in the field of management, and his areas of expertise are tobacco control, tobacco cessation, leadership, management, and other aspects related to health management. He has n number of papers published in international and national journal, and he has authored many books related to management. So I request Dr. Sonu to please deliver the program overview. I welcome you, sir.
Good afternoon. Good afternoon to all the participants from our 161 ITEC countries who are participating in this coveted flagship program of Ministry of External Affairs, Government of India. And I also welcome our experts who are our Corona warriors from our nation. So I'm especially thankful to our director, Dr. Jagatram, for his support in this endeavor, in which we have completed 2 phases of the program, in which we have trained over 140 participants from 6 continents. So this is the 3rd phase, in which the top level decision makers and the hospital administrators are part of this program. And through this panel discussion, they will be learning about how they can manage COVID in their own countries. So just to give you a brief overview, this program, I have already told you about the 3 phases. The first phase was 27th April to 1st May, and then followed by 11th May. And now it is on 18th May, we have the panel discussions. So the program was conceptualized seeing that the corona pandemic is being faced across all countries, and there is a need for disseminating knowledge so that the countries can plan, execute, and monitor various aspects of corona, and also to improve the effectiveness and efficiency of our healthcare delivery system and enhance the capacity of our health workforce in different countries. So our program objective was to enable participants understand the concepts of COVID-19, to build their capacity, and to illustrate the best practices and experiences of our country so that they can replicate in their resource settings. And also they should be able to appreciate the gaps in the current scenario and envision future trends for making decisions in their own countries. It was the online webinar followed by the panel discussion of the experts. Every webinar was followed by a panel discussion with the experts, and we have 15 experts every time from different departments, whether it's microbiology or it's medicine or all the aspects. So they need to learn about the innovative strategies, see best practices, and we have enlisted almost all countries' best practices in this webinar series of webinars, which contain 28 lecturites. So this is program outcome at the level of organization so that they can improve the performance and the productivity of organizations and make good decisions at the organization level. So after every time the participants gives their queries in the suggestion box, and there was a social network in which they post their pictures and a lot of other things, so that this program is disseminated to other people so that they can also learn from the best practices in India. And we gave the overall feedback to our Ministry of External Affairs, who are really liking this things. So these were the participating country during the webinars. So we have participants even from South America, from African countries, from SAARC, from Southeast Asia. So these are the number of participants who have enrolled themselves in the program. And this is the current panel, which after some point of time, we'll be having the discussion on how to manage the COVID situation in the countries. And these are our senior participants from different countries who will be participating and who are listening live to these discussions. These are other participants. And this is just the glimpse of first batch in which 27th April, which we started. And we have these participants who participated. And these are the participating countries. This is second batch. These are the participants, these participating countries which participated. And these were the lead speakers, which we have from medicine, from community medicine, from virology, from administration. We have municipal commissioner and a motivational speaker, ex-IAS, Mr. Vivek Atre. And then from psychiatry, from yoga, from hospital administration, from communication. And there were a lot of comments and responses. And they were all good comments and responses you can see from our Facebook pages and various media. And these were social buzz, and we got almost like 5,000 tweets every time. And these were some of the contests which were there. People made slogans, and there was a lot of social media buzz. So this program was conducted as a part of International Public Health Management Development Program, which we are doing with Ministry of External Affairs for last 4 years. And we have a lot of people from India and abroad. So 21 countries. So these are some of the glimpses of previous programs on health management, which we conducted from different countries. We have conducted almost like 7 programs in last 4 years. And these were the feedbacks, appreciable. They appreciate the organization, they appreciate the speakers, they appreciate the program, and participants were engaged in various contests. So this is an organization committee who is working day and night to make the program a success. And there were other contributors of the department who were really backbone behind this program. So Dr. Arpit Gupta, Assistant Professor in Oral Health Sciences, was part of this. And these were our social media networks, iphmdp@gmail.com, and then Facebook page. So thank you very much. And I hope to have a very good and fruitful panel discussion today. Thank you.
Thank you very much, sir. Thank you for such a dynamic start. I hope the objectives of this program will be definitely achieved by the end of this program. So not taking much of time, we'll move on to our panel discussion. I hand over the charge to Dr. Sonu Goyal, who will be the moderator of this session. And I hope you really enjoy the panel discussion. Thank you. Over to Dr. Sonu Goyal.
So dear colleagues, I welcome you again. And again, I wish to invite you to witness the live panel discussion, Manage COVID-19 Pandemic, Experiences and Best Practices of India. So this panel discussion, as I already told you, is a part of series of online programs for ITEC nations. And it's a matter of pride that PGIMER has been selected for conduction of this series. And I'm proud that we have trained 140 senior health professionals from 6 continents on COVID management. So we have in this senior health administrators and decision makers from many countries, and technical expert and decision maker of India will share the best practices in their respective country settings. So let us start this live panel discussion. So at the outset, I wish to invite Professor V.K. Paul, who is a member of National Institution for Transforming India, that is commonly known as NITI Aayog, where he leads the health and nutrition verticals. He leads the high-level technical committee of public health experts for COVID-19 to guide the prevention and control activities in the country. He's also member and head of key government empowered committee on medical management. He served as member of faculty at AIIMS New Delhi for over 32 years and head of the Department of Pediatrics for nearly a decade. He was conferred prestigious Ehsan Dogmaki Family Health Foundation Prize by WHO at 2018 World Health Assembly, and he has played a pivotal role in formulating the Poshan Abhiyan and Ayushman Bharat initiative. So, sir, we have a few questions for you. Sir, you have been spearheading the battle against the COVID-19 in India. So how do you maintain the coordination between centers and states, as our country has a federal structure and health is a state subject? Establish and maintain the international dialogues between India and other countries, and maintain watchfulness, and finally feed to our Honorable Prime Minister Shri Narendra Modi. So Dr. Paul, are you with us? Dr. Paul? I think he has some network issues. So I think he's trying to connect. So in the meantime, I'll just take questions from Madam Vinny Mahajan. So Madam Vinny Mahajan is Additional Chief Secretary, Department of Housing and Urban Development, Government of Punjab. And her current responsibility, she's holding the ACS charge of Department of Industries and Commerce, IT, and Investment Promotion since August 2018. And an economics graduate from Lady Shri Ram College. She has completed her MBA from IIM, Calcutta in 1987 and joined as Indian Administrative Services in the same year. So during her term as Additional Chief Secretary of Department of Revenue, Rehabilitation and Disaster Management, Punjab became the first in the country to roll out the National Generic Document Registration System. So ma'am, you have worked as a top bureaucrat in health sector for quite a long period of time in the past, and now you are spearheading the COVID pandemic at state level in Punjab. So in the state with special challenges like Punjab being a frontier state, there is a lot of NRI population, its economy is based on agriculture, and now there is an issue of out-migration of workers to different states affecting sowing work. How do you see the role of bureaucracy in leading the battle against COVID in the state?
Thank you very much, Dr. Sonu Goyal, and thank you to all participants in this program today. You've asked a very difficult question. We are all, I think, together trying to learn about COVID, a new disease, a new virus, and trying to understand how to deal with it. In particular, we saw the experience of other countries in the world which went through devastation as even the advanced countries saw such large outbreak and so many people requiring intensive care or requiring ventilatory support that the hospitals were overburdened. And we had horrific images of people dying because they could not get the required medical treatment, even in countries that we considered highly developed and prosperous. And so in India, we followed the trajectory of our own choice, which was to do a very hard lockdown, which was to prevent the spread of this pandemic. And in particular, the effort was to use the time gained to ramp up our infrastructure. We all know that the medical infrastructure has to be taken to a level where, should the number of cases rise, we should be able to deal with them. We very quickly learned that this virus results in a problem where about 80 to 85% cases are asymptomatic or mildly symptomatic. They do not need advanced healthcare. But yes, in a country like ours, where there are slums, where there are situations where people cannot actually be strictly isolated or quarantined, we came up with the concept of COVID care centers as institutional isolation facilities. We realized that there are about 15% cases which need oxygen support, and we quickly ramped up our hospitals, district hospitals, subdivisional hospitals, even community centers for piped oxygen supply or even cylinder support for such patients as would need the oxygen support. And most important, we know that there are 2 to 5% cases which perhaps would need intensive care and ventilatory support. And we quickly assessed which are the ICU beds, the ventilator beds in our public and private sectors, and how do we work together, the government as well as the private sector, to make sure that when the requirement arises, should it arise, we should be able to provide COVID patients with the care they need. But at the same time, we are also conscious of the fact that in our country, there are other healthcare requirements, there are non-COVID patients, and we have to be absolutely able to continue to be able to give them services, including public health services relating to immunization and others. So this was a complex exercise. I think it is a wonderful effort jointly by the Government of India and its various institutions, including the top academic and research and healthcare institutions such as AIIMS. Of course, Niti Aayog played a stellar role, and institutions like PGI in Chandigarh, and also I think the state health and medical education departments working in tandem, working jointly to ensure that all the learnings, global learning as well as national learnings, are very quickly disseminated, are very quickly adopted, put in practice. And I believe that we have been able to ensure that by now, as the lockdown is easing up nationally and in all states, we can say with some degree of confidence that we have ramped up our healthcare, both in terms of infrastructure and in terms of human resources. And we are confident that we will be able to deal with any upswing that might happen, because we also know that the lockdown leads to economic activity taking a hit. There was a long period when there was no industry or economic activity worth the name. And that kind of economic distress also cannot be prolonged beyond a point. So I think the country as a whole, as I mentioned earlier, all institutions jointly have applied their minds to this, have tried to ensure that while on the one hand, the health requirements of the people are not neglected, they in fact have taken priority always, but at the same time, we should be in a position where we allow economic activity to resume so that the people's misery is not compounded by their economic stress.
Wonderful, ma'am. So a similar question related to the answer which you have already given. At a point of time, there was surge of cases in Punjab. And now we have been seeing over a period of time, it has become stabilized or even they are coming down. So whom do you want to give this credit to, and what special measures you have taken in this regard?
I think we all know that in India, the virus was brought in, of course, from foreign travelers, and Punjab and other states which have a large number of NRIs coming back, there was obviously a very serious threat. And we did see that. We saw that a single person coming in, if in the beginning, when there was not enough awareness in the population, there was spread of the virus from within the family and to other close contacts, and we saw hotspots emerging. So I think there has been a massive IEC effort, and that is really critical. There has been a massive public health effort with teams going house to house, village to village, ward to ward, and trying to determine which people are symptomatic or which people may have been contacts of known positive cases, to be able to quickly alert them, to isolate them as required. There have been massive efforts at making sure that we do not allow the positive cases to infect others. And I think those showed results. There were periodic spikes. We know that there were some people who returned from other parts within India, from Nandedsa, from Kota, from other places. Some of them tested positive, and there again we saw a spurt, but again a massive exercise in making them go through institutional quarantine, in making sure that their contacts were limited. I think the health department has done a wonderful job. The medical education department, which is dealing not only with the level 3, the ICU facilities, but also ramped up testing in such a big way. We know we had zero facility for coronavirus testing, even in the early March 2020. And then lab after lab in medical colleges, institution after institution got up and said, we will start doing COVID testing, and RT-PCR testing expanded majorly so that we could with confidence say which person is positive and therefore needs isolation. I think the credit goes to many, many people, but there is a long way to go. We all understand that, and therefore it's too early to celebrate. We will keep working together. The state government, the central government and its institutions, the health and medical education departments, of course, are bearing the brunt of this battle. They are the frontline departments, but all other departments, all other parts of the government, every officer is supporting this effort, and we are trying to do our best. But the citizens and their response has been key. And I think if we want to congratulate anyone, we must congratulate the citizens of our state and our country who quickly recognized what the issues are and responded to them.
Thank you, ma'am. It was a laudable effort by state of Punjab, especially in this situation when it is a challenging state. And you and your team has wonderfully done well in managing this COVID pandemic in the state of Punjab. Thank you much, ma'am. Thank you for your time, ma'am.
Thank you very much.
So after Madam Lini Mahajan, we have Dr. Randeep Guleria, who is a director of our renowned institution of India. Everybody knows it is All India Institute of Medical Sciences, New Delhi. He is an Indian pulmonologist credited with the establishment of India's first center of pulmonary medicine and sleep disorders at AIIMS. Besides this, he was honored by Government of India in 2015 with Padma Shri, one of the highest Indian civilian award. Also, he is associated with WHO as member of Scientific Advisory Group on Immunization and Influenza Vaccines, life member of Association of Physicians of India, and serve as a consultant to International Atomic Energy Agency. Dr. Guleria was the personal physician of Shri Atal Bihari Vajpayee, former Prime Minister of India, and his research finding has been recorded by the way of many book chapters and 286 articles. So, sir, we have, because AIIMS, everybody sees AIIMS as one of the institutions where all the guidelines are being formed and all the things we try to replicate AIIMS. And it's the topmost medical institute of country having a population of 1.3 billion. So just want to ask from you, what role can a tertiary care institute like AIIMS New Delhi can play in managing COVID? And can you spell out the role played by your institute in handling COVID-19?
Okay, thank you very much for having me over. And it's indeed a pleasure. As you rightly said, tertiary care institutes, whether it be the All Institute of Medical Sciences New Delhi or PGI Chandigarh, have to play a stellar role when we come with such a situation like the pandemic that we're facing. We at AIIMS realized very early that we will have to be involved in a very big way, and we will have to do multiple things to be able to provide directions and also be able to convert our hospital into managing patients who are COVID-19 positive. So we started off in the early part of, I would say, end of February, of having regular meetings, and we still have that every day at 8:30 in the morning with our entire faculty, our nursing staff, our residents, to see what we can do in terms of improving the facility. Because of that, a lot of things were done. We started looking at how do we convert our hospital into areas which could be for COVID care and which could also be for non-COVID patients, because in this time we need to see that while we are focused on managing COVID-19 patients, the non-COVID-19 patients should not also suffer. So strategies were developed. What we did as far as our hospital is concerned, I'll just quickly mention that we converted our trauma center into a COVID hospital, and the trauma patients, because of the lockdown which had become less, we shifted all of that to our main hospital. The newly upcoming Burns and Plastic Surgery Center, which was going to take at least 6 months minimum to get ready, we fast-tracked that and we converted 2 ICUs there and the ground floor into what we call COVID suspect area, where patients who are suspected to have COVID can be screened. And depending on the report, they can be then shifted either to the COVID positive area or the COVID negative area. We also realized that there is an importance of having training. And therefore, we started various webinars and modules, not only for our own residents and our own healthcare workers, but for people across the country with the support and with the guidance of the Ministry of Health and Family Welfare. And a large number of modules have been made as far as training is concerned for infection control, ventilatory management, management of COVID-19. And these are conducted both by our faculty, our residents, and by the nursing college also, so that we are able to train people in various areas as far as this is concerned. As we were going along this path, we also realized that there is a need to look at other things, because we reached a phase when there was this whole issue of shortage of PPEs, and we decided we have to be innovative. And therefore, a group got together which started doing some research projects on seeing can we reuse PPEs. And as a research project that used various spores and bacteria on PPEs which had been used, and used various ways of seeing can we recycle PPEs. Did this for 6 or 7 cycles using different methodologies, and then came out with a mechanism where we could say that you could use PPEs if need be in a recycled manner, the high-end PPEs, the level 3 PPEs, and at the same time it was sterile and there was also no harm as far as the fabric was concerned. This has now been given to the Ministry of Health, and this has also been published as a paper as to how you can reuse PPEs if that shortage happens. Along with that, we also decided that we have to look at other things. We started what was known as a Connect facility, which the Honorable Health Minister inaugurated, which was basically to develop a center, which we did in our guest house, to be able to connect with all physicians in various areas. It could be at a district hospital, it could be at a state hospital, or in any other area, to be able to talk to them and educate them and address their issues in managing COVID-19 patients. Remember, COVID-19 is a new infection. It sometimes leads to acute respiratory distress syndrome. And there are treatment strategies which a person at a primary level may not be well versed with. So by talking to critical care specialists, pulmonologist, infection disease specialist at AIIMS, he can therefore modify his treatment strategy, and it gives him confidence also how to be able to do that. As many hospitals have started, teleconsultation has also started. We started looking at robotic devices and consultations so that our healthcare workers didn't have to go repeatedly into the area where COVID positive patients were available, and they could be, telecommunication could be established. So many things were done. And I think we were able to also come out with a number of guidelines, which the ministry has now adopted as far as this is concerned.
So my second question, sir, is related to those guidelines and standard operating procedures. So everybody looks AIIMS, New Delhi, for SOPs, guidelines, and they are very comfortable replicating them in their own institute. So how do we maintain that collaboration with ministry, with ICMR, with NITI Aayog, with PMO in framing those guidelines, which are changing almost on the daily basis?
Yes, you're very right. The guidelines keep changing because as we learn more and more about the infection and how it behaves, our strategy has to change. Only recently we've changed our discharge policy guidelines based on the data which has emerged that you may be RT-PCR positive, but you are not infectious, and therefore you don't need to stay in hospital for such a long time or have 2 RT-PCR positives. It's a big challenge because you have different organizations involved. But luckily, we have one advantage, that we have our own faculty and our own members whom we talk to each other in the morning, also members of these various bodies, whether it be the ICMR, National Task Force, whether it be the Ministry of Health and Family Welfare, the Joint Monitoring Group, or the NITI Aayog, or the PMO. So there is some degree of continuity because we all discuss things in our morning meetings and debate upon all these issues. And they get then translated to other groups which are in various organizations. But I do agree with you that sometimes there becomes conflicting opinions, and especially since it is an evolving and emerging infection, different groups may have different thought process, and it takes some time to get everyone on board.
Yeah. So, sir, related to it, I think there is a lot of issues in any institution about coordination and collaboration within departments. So how do you maintain that?
So that is a big challenge. It's not only coordination and collaboration between departments, it's been different between different groups. The nurses, the residents, the other the support, the technical officers, and then of course the faculty. So there is a need that we get all of them on board, discuss everything with them, and then work in tandem so that they also realize that their interest is also being looked after, and we are working together as a team. I think that whole message that this is a team effort and we're all fighting a pandemic, and we must sort of not think about our petty issues, but look at the broader picture, is very important to convey to them. Very often, by talking to everyone, by having a group discussion, it helps in getting this over, and getting a lot of faculty on board becomes a big challenge, because faculty from surgical specialties have different issues, from medical specialties have different issues, and the residents have different issues. So it's a challenge to get all on board, and it sometimes means that you have to listen to everyone and come to a acceptable balance.
Yeah, and thank you, sir. Thank you for a very nice discussion on some of the very key topics. And I hope you will continue spearheading and leading this COVID pandemic from the front. And I hope that the condition of COVID-19 will come down soon. So thank you, sir. Thank you for coming, and thank you for sparing your time.
Thank you very much, and all the best. Thank you.
Thank you. So now I'd like to invite Dr. Harshad Thakur, who is Director of National Institute of Health and Family Welfare, Government of India. So he is presently the Director of NIHF, who is a premier technical institute under Ministry of Health and Family Welfare, Government of India. So he served as a professor in Tata Institute of Social Sciences for 19 years and a lecturer in KEM Hospital, Mumbai for 9 years. He has served as a chairperson for Center for Health Policy Planning and Management for 2 years and chairperson for Center of Public Health for 5 years. So he has expertise in guiding research projects of PhD, MPhil, MPH, MHA, and DHA scholars. So, sir, so we have NIHW is a top level body of India whose task is to train people and build their capacity. So in this Corona situation, what role is being played by NIHW in training manpower of different states and empowering them?
Okay, good afternoon, everyone. And once again, I would like to thank organizers for inviting me. So as you know, NIHW, National Institute of Health and Family Welfare. So we have a network of SIHFWs, State Institute of Health and Family Welfare. And also we have Health Family Welfare Training Centers, HFWTC. So this is spread all across the country. And so we are working closely with MOHFW, Ministry of Health and Family Welfare. So we help them in finalizing the training materials, even their translation in Hindi languages. So along with MOHFW, we have a WhatsApp group, and which includes all the ministry officials, HRW personnel, even NHM staff is there, and then faculty and MD residents from NIHW are all actively involved in this. So on day-to-day basis, it is seen that training is carried out properly at state level, district level, and local levels. And if there are any issues anywhere in the state, they are resolved here. Simultaneously, we are preparing initial part. We prepared a lot of IC materials in both Hindi and English languages, and we followed by its dissemination all across the states. And the focus was mainly four parts: to give scientifically correct information, to talk about various myths and misconceptions, then to manage incorrect information, fear, hatred. So how to manage that? And then we provided information about other useful and authentic resources on the internet related to the same topic. Then, as you know, we have many training programs which are already running. So we are planning to make them online, and COVID component will be inbuilt part of all these training programs. Then we have partnerships, networking with various international organizations, for example, CDC Atlanta, Center for Disease Control Atlanta. So along with them, we are developing a training program for various health providers in the country, mainly doctors, nurses, paramedical staff, administrators, and other staff associated with provision of health services. So it will be shortly rolled out. And then there is the Asian Development Bank. So along with them, we are using this opportunity to upgrade our IT services, and will be developing platform for conducting online courses. And initially, our thrust will be on the courses related to COVID, but gradually will include other courses as well, because COVID has given us opportunity to improve our public health services, and public health awareness is now quite high. So we want to maintain that tempo in the community. I think that's it. That is for your.
Yeah. So one more thing, sir. This unprecedented situation has also seen many guidelines and SOPs, and that too revising on the day-to-day basis. So I asked a similar question to our AIMS director. So how you have ensured linkages with NITI Aayog, Ministry, NCDC, and other agencies while regularly updating these guidelines in your trainings, because your trainings are spread over at state level through SIHFW. And further, how do you ensure that these guidelines and SOP reach the right healthcare professionals of the state and so that they remain updated on them?
Okay, so there are two components here. So one is linkages with various other institutes. So as I told you, our students and our research staff, they are placed in MOHFW at various divisions, training divisions, medical education division, EMR division. So this ensures that we get correct information from them, we get revised guidelines, and we regularly update content of our training. So this helps in us in our improving our training components. Then our senior faculty members along with junior faculty members, they are spread all in few states of India in the form of central monitoring teams. So they are in the community. So they are placed in Rajasthan, Uttar Pradesh, and Andhra Pradesh mainly. And this positioning of our faculty members in the community. So they give us direct feedback from the local level health providers and the community and the state level providers. So we get direct feedback from the community as well. So that also helps us. Regarding the second part, means as I mentioned earlier, we have already formed a WhatsApp group along with the ministry officials. So we ensure that correct and revised guidelines and SOP reaches health professionals of the state so that they remain updated. So this it is like a cycle. So we get the information, we feed it in our training program. Again, we through the WhatsApp group and our placement of our staff and faculty in the community, we get direct community feedback, and that helps us in revising and updating our training programs. Yeah.
So, sir, it's really a challenging task for you, and I can imagine that the guidelines are almost changing almost on the daily basis, and you are updating the health professionals across the states on the daily basis, and getting the guidelines, true guidelines and true things at the state level. So it's really a challenging task, and you are accomplishing it quite successfully. So I congratulate you for this endeavor, and I thank you for being a part of this discussion.
Thank you very much for inviting me. Thank you.
So now we have Dr. A.M. Kadri, who is Secretary General of Indian Association of Preventive and Social Medicine. And he is Secretary General of IAPSM for more than 3 years. He's a professor in Department of Medical College in Gujarat, well-known academician and teacher, and editor-of-chief of IAPSM book on community medicine. So since he has joined that Secretary General, he has made a lot of initiative for the association, and now he's doing a lot of things in COVID management along with the central government. So Dr. Kadri, so we have a question for you. You are a Secretary General for a association which have over 10,000 members. So in this emergency situation, how you have ensured that your association has played a dominant role in the country to manage Corona?
First of all, hello, good afternoon. First of all, congratulations for such a wonderful program where large number of the people are from the various countries are involved, and the people who are experienced and expertise in different fields are sharing their views and experiences. So congratulations to the team. Now coming to your question. So how we have ensured the our dominant role? You know, IAPS, Indian Association of Preventive Social Medicine, is a professional association. So it is a group of expert who are people who are having the degrees in the community medicine and preventive social medicines, and we are having the network of the state health chapters. And as you have suggested that mentioned that we have large number of the people across members across the India. So as the COVID scenario of the COVID has come into the India, immediately we have written a letter to all the members and charted certain actions point what all the members should carry out in this COVID epidemic situation, and intimated to all the each and individual member are is communicated about their in different areas, right from understanding what is the epidemiology of the disease to the what is the guideline and what is the local factors, scenarios, and what the role they can play as an epidemiologist, they can play as an academicians, what they can play as a role as an analysis, as a teachers, as a trainers, or as an expert in the community medicine. We have charted out this all their role and written letter to all the members. Also, we have remained in contact with all the members, and we identified some active members who are the experts, experienced experts, and formed 2 or 3 groups for formulations of different suggestions or the guideline to be written to the ministry. So we have prepared such types of the different. We have our experts have reviewed the epidemic situations across the world and written based on this, and reviewing the literatures. Based on that, they have given certain suggestions to the government of India from time to time. Also, in the beginning, we as a voluntarily, we have received a request from the NITI Aayog, where they have requested us to, in the early phase of the epidemic, to know the readiness of our institute hospitals for managing this epidemic in case of the surge of cases of the COVID-19. So we have carried out, with the support of all members, we have carried out the survey and submitted the report to the NITI Aayog, and it was well appreciated, and we have received the acknowledgement that it is useful and use it for the further discussions at the NITI Aayog also. Along with the FICCI, we have developed the e-learning courses for healthcare worker, where we are the knowledge partner, and we have developed e-courses learning which can be accessed, and anybody can learn this. Healthcare worker can have to learn COVID-19 about this. Also, many of our members are involved into, like our president himself is the member of the ICMR task force. Many of the other members are also in the member of the task force of the ICMR research committee. In fact, one of the research was the zero surveillance. ICMR is carrying out in the 69 districts of across the India, where the IAPSM is taken a rope in and requested to identify the community medicine people and be as a supervisor in each district. So the letter is written to the IAPSM president, and we have now requested the community medicine department. So community medicine department is involved into the supervision of the facilitating this implementation of zero surveillance, which is right now going on across the India. Many states are already completed. So community medicine members join them as a supervisor to oversee the activities of zero surveillance also. Also, we have participated in the one of the VC with the Prime Minister and our President, IAPSM President-elect. She has shared the views and given the suggestions to the Honorable Prime Minister regarding how can be managed epidemic, and what are the technical activities to be carried out along with the other activities. Like important suggestion was that giving the importance to the epidemic intelligence services, etc. Also, another thing is that we are having now planning to have another study from the ICMR. We will be joining with the identifying the predictors of the COVID-19 disease severity. So also IAPSM is now with the support of the various institutes, IAPSM will be directly involving, and just yesterday only we have received the note from the approval from the this ICMR. So will be having this research in few of the high load institutes across the India will be carrying out these studies also. Besides that, we are having the IJCM, our journal, where we are having the editorials and the commentaries and in the this COVID, so that which is the one of the as an academicians where the views are there in the open domain and people can access and it can be disseminated to the wide populace, wide group of the people. And definitely over the period of time, once things will be settled, we'll be having various good research articles will be published in the IJCM so that we can be the good disseminators of all the COVID related literatures or the knowledge.
Yeah.
So these are some of the.
Yeah, you have played a dominant role, not only in academia, but also research, implementation, even in the policy related aspect, and highlighted the role of public health and preventive and social medicine to the policymakers. So, sir, how you have ensured to maintain the linkages at different levels, right from policy level to implementation?
I think ensure linkages is, I think what are the activities we have carried out just in the earlier question, what I answered, that is to be linkage only, with the linkages only. The linkages, how we can ensure the linkages, that is with our like president to the member. Every person, we are linked with each other. In nowadays of the technology, we are very well linked with the, though we are locked down, but we are individually president to the member are linked. And as I said that we have written a letter. Besides that, with different platforms, we are connected with each other members, and these members are now connected with the different institutes, as you have suggested, from policymaker to the implementers. Right. So different stakeholders are being having a rapport being built by our different office bearers to the members at the different levels. For example, I will be saying that NCDC, we are playing dominant role as a policymakers. I have just suggested that in the policymakers, we have worked with the Niti Aayog. We are our members are in the part of the ICMR also, research part also is there. We are also involved with we have attended one of the meeting with the secretary, Priti Sudan madam also. So in that way, we are ensuring that besides that, NCDC already requested and they asked as the community medicine people, faculty, particular faculty, because largely our members are faculties. Typically, they are in the many of the associations. They are the private practitioners. We are the academicians, teachers, faculties are there in the government and private. So as a rapid response team, they have categorically said that. So as a rapid response team members, they are actively involved at the implementation level also. So they are working there as a rapid response team members. They are involved into the training and they are also involved in the monitoring, surveillance, and the screening activities as well. So these are the way we are involved into policy to the implement.
Yeah, so I can see, because being a member for IAPSM for last 20 years, I can see the lot of changed role in IAPSM. And how do you see how do you perceive the changed role of association in future in light of Corona pandemic? Does it change? Like, does the role of IAPSM change over a period of time since Corona pandemic?
Yes, I will be saying definitely not change. I think it will be a huge responsibility that we have to take up, because in this Corona pandemic is there, but it is not the first pandemic, Corona, which is there. In fact, over the last 5 or 6 years period, when we are looking at this, frequently we are having the different types of the pandemics, threats of the epidemics and pandemics are there. So definitely now, as an IAPSM, we should come forward, and it is our responsibility to, based on this COVID experience, because now the policymakers, politicians, bureaucrats, now they all are the sensitized and they are now realize the importance of the preventive measures along with the clinicians. I will be unfortunately saying that largely people are many times clinical activities. We are always look into the glamours. Definitely, they are important activities, and it has got clinical activities, has got the important roles. But now people must have realized that clinical activities are important, but preventive activities is much more important than the clinical activities. So the country requires the cardiologists. Now, as an association, I will be saying that a country requires the cardiologists. Now, our role may be there, that we should pitch for the, but at the same time, country requires more than the community medicine physicians than the cardiologists. Country requires the doctors, but country also requires more than the doctor, the health worker, community health worker also requires. Community, we have to now funding. When we are saying that funding, we require more funding. More than 50% funding should go for the preventive care than the clinical care. I think this type of responsibility we have to take up and should advocate with the government and the policy makers that it should be preventive activities should be considered as the investment, while the curative activities are the expenditure. That view we have to, our responsibility is that view we should be projected, advocated, and to facilitate at the different level. At the ultimately, this corona epidemic, besides that, that it has highlighted the importance of preventive activity. At the same time, it has also highlighted wherever the healthcare system, public health, particularly a healthcare system, public health system, which has got the dominant preventive healthcare arm, has made the difference in the controlling the pandemic. So I think as a strengthening healthcare delivery system, and not at the time of pandemic. So we have to buy the time and go for lockdown. In fact, we have to have our healthcare delivery system in a way that it should be ready, that if any time any pandemic or any disaster strikes, the second moment we should be ready for the delegate. So that types of I think as in the we are seeing that IAPSN should take up the responsibility to, as an association, our responsibility is largely for advocacy, for supporting the healthcare system in a way of research, training, teaching, etc. But definitely on these 4 or 5 areas, I am seeing that as IAPSN, it is not our role, but I will be saying it is our responsibility for dealing such types of the pandemic and other activities other diseases affecting community at a large.
Yeah, wonderful. So I think very nicely said that it's not only COVID, but also COVID is an opportunity to strengthen our existing health system so that whenever a pandemic strikes, so we should be prepared for it. So thank you, sir. Thank you for your comments. And I hope that Association of Preventive and Social Medicine will take the front roads and manage and help country manage the corona situation. So thank you.
Thank you very much.
So now we have Dr. H.R. Nagendra, who is a Chancellor of S. Vyasa and Padma Shri, a visionary of UN's adoption of June 21st International Day of Yoga, which is spearheaded by Honorable Prime Minister of India. So he is a Padma Shri awardee 2016 and the Chief Architect of Indian Ayush Research Program. He is an engineer by profession from IISc Bangalore and over 100 papers and 35 books. He moved from NASA to start the world's first yoga university, that is S. Vyasa, in early 1980, with the sole objective of making yoga a socially relevant science and translating the vision in ancient yoga literature into evidence-based system of wellness. His vision is to bring the best of the East and the best of the West together to benefit the mankind. He advises government and Niti Aayog in major yoga and integrative medicine related program in the country and is instrumental in bringing all major yoga gurus to develop consensus yoga protocols and accreditation system to national and global yoga education and research. He has been instrumental in establishment of AIMS Center for Integrative Medicine. He guided India Yoga Association as the president in coordination with Swami Ramadev, Shri and other eminent yoga gurus. So first of all, I'd like to thank you for being part of this discussion, very important discussion, sir. So sir, we have a question for you, like how do you define yoga? People have different names and different connotations of yoga. So according to you, what yoga is?
Thank you very much, Sunukoyalji, for your wonderful coordination that you are doing. And I congratulate all the experts and for organizing this beautiful panel discussion on the most important dimension of managing COVID-19 by various techniques. As many people think, yoga is some sort of physical exercise. But yoga is not just that. It is a science of holistic living. The word yoga comes from the root yuj, yujyate anena iti yogaha. That is to combine, join. So one is to join our small little individual personality with the all-pervasive total personality to raise ourselves from our normal level to become great, super, divine human beings. and to move towards health and better health and perfect health and towards more and more happiness and towards bliss. So that is the goal of yoga. And various techniques of yoga have been brought forth, and particularly Swami Vivekananda has brought four main streams of yoga: the Gnana Yoga, the path of intellect; Raj Yoga, the path of willpower; Bhakti Yoga, the path of emotions; and the action, that is the Karma Yoga. Using these techniques, we have been trying to bring forth the needed preventive dimensions and also to deal with these modern pandemics, particularly the NCDs and particularly the present COVID as well.
Yeah. So, sir, wonderfully described yoga. So, how do you see yoga integrating with modern?
The advantage of yoga is that it can go easily and join hands as an add-on to the modern medical system or any other medical system, because it's a non-pharmacological in its dimension, and we have been able to bring this dimension for various treatment. MD Anderson Cancer Center, we have been able to add on, and here in Holiday Institute of Medical Sciences, we brought out this advanced center for research, and here we brought yoga into every field. All the nearly 20 departments in AIMS have been able to incorporate yoga as an add-on and have rigorous research dimension. So we go with the aim of having intensive research with a randomized controlled trials and then long-term study and pan-India thing. For example, we did a very pan-India things on diabetes, yoga for diabetes throughout the country, where we screened nearly 2.5 lakh people and brought out the wonderful results about the prevalence and also the new methodology to track it in a very fast mode. Normally 2.5 lakh people take almost 3-4 years, but we did the whole thing in 3 months with a large number of volunteers and trained people in the field of yoga. As you know, Indian Yoga Association have all the top masters, as you mentioned, Swami Ramdevji and others. We were able to build this. Now we have taken up another survey for this COVID called CHAS, that is COVID Health Assessment Scale. And through that we'll know how to do that. Already we have about 25,000 people who have already given their data, and this will help us to see which portion, which country there is more and more, and how it is prevalent in various sectors. And these things we are doing that will help us to put our resources into those areas where we have to do. But prevention is very, very important. Therefore, we have developed the special yoga modules, very simple modules, everybody can do for prevention. It will take only 10-15 minutes, and people, we are asking them to do that 2 times, 3 times, 4 times. And a lot of people who are in the quarantine, also in the locked up homes, they have been doing this. Also, we have developed some special treatment modalities because we had a lot of experience in our Arogyadam 400-bed facility where we had very severe patients of cancer and other paralysis and other people who could not move out of their bed also. For such people, we had done a lot of work in asthma. Probably you know that we published our paper in BMJ way back in 1986. Very severe conditions of asthma also we have been able to manage with yoga as an add-on to the conventional thing. So modern medicine we accept. At the same time, it is not adequate, it is not full in this thing. We have to add on the dimensions of yoga. That's how we have been able to do that. So similarly, add on, also we had developed the modules for this, and we'll be able to bring these things. And in many places, we have been finding that is very, very effective dimension.
Wonderful, sir. I'll come back to you, sir. Again, we have a lot of other questions and many participants are asking about yoga. So I'll come back to you after 10 minutes. Okay. So, sir, I am in between taking Professor V.K. Paul. I think Dr. V.K. Paul, sir, are you here with us?
Yeah.
Okay. So, sir has been, I have already introduced Dr. Paul before. So, sir has been spearheading the battle against COVID-19 in India. And we have been listening to him for almost every day. The guidelines are changing every day. This is really a challenging situation, sir. And how do you maintain the coordination between center and states, as our country has a federal structure, health is a state subject, and establish and maintain international dialogues between India and other countries, and maintain watchfulness, and finally feed our Honorable Prime Minister of India?
Thank you very much for the opportunity. Good afternoon, everybody, and I'm honored to be here with colleagues from countries across the globe. And thank you, Director PGI and colleagues at PGI for creating this opportunity. And thanks to the Ministry of External Affairs. What you have asked is how country at the macro level at the policy macro level is responding to this pandemic in our country. Let me say there are a couple of systems that are operating. One at the highest level of the government. Then there are science interfaces that we have created. So let me dwell on both, more so for the latter. But I would say that the response, because we are a federal country, ultimately the work is implemented, actions are implemented by the state governments, and even more so by the local administration at the district and the city level. We do know that the pandemic scope in India is largely urban, and that also confined to a limited number of cities. Almost 2/3 of our cases are confined to just about 11 cities. It has been so city specific. So the way it works is that the coordination is provided at the Ministry of Health level, at the level of the administrators through the principal secretaries, where the video conferences are held, guidelines are shared. So there's a technical interface, there's an administrative interface, and the Honorable Health Minister speaks almost on a daily basis to different health ministers. So that's one interface. Then there is an interface at the level of the Cabinet Secretary, who's the head of our administration and bureaucracy in the country, with the chief secretaries. And there are video conferences at least twice a week, if not more often than that as required. And the Government of India has constituted for the response 11 empowered groups, which are cross-cutting in terms of their participation from different ministries. For example, there is one that I head, which relates to emergency response and preparedness. And here I have participation from the disaster management group, the Prime Minister's office, the Ministry of Health, and so on. Likewise, there is one on supplies, there's one on communication, one on relief, one on grievances, and so on and so forth. So that's how the cross-cutting teams have been created, representing more than one ministry. That's one set of structures that are functioning. And through that, the ideas are discussed, ideas are crystallized, and a response is created. And these, because they are empowered, they also are responsible for making sure that the implementation happens. So the ministry level, then the cabinet secretary level, and this is the cross-cutting level across the ministries to perform targeted functions critical to the containment of COVID-19. And then, of course, there is the Prime Minister's office, which coordinates all the activities. So this is one level. The other level of our response relates to the science and technology and best practices paradigm. And there are three structures that we can talk about. There is one called Joint JMG, Joint Management Group, which looks at guidelines, which looks at technical guidelines, and this is intra-ministerial system with participation of experts. Then in the Indian Council of Medical Research, there is a national task force on COVID-19, which is primarily for evidence for clinical testing issues, clinical issues, epidemiology, operations research of that paradigm. And it has experts and it has involvement of clinical institutions. It has participation of ICMR laboratories. It has experts who are epidemiologists and so on. So that is where, for example, the discharge criteria, clinical care criteria have been developed. This is where we decided to give hydroxychloroquine to healthcare providers. This is the place where at least 12 treatment modalities have been systematically studied. This is where also we are looking at Ayushman products, Ayurveda products, to be taken to research and to therapeutic domain. So this is a science group. but largely clinico-epidemiological group. Then there's another structure for science, which is on vaccine and SNT work. And that is a mechanism where it is the principal secretary, principal scientific advisor, and I co-chair that. In NTF ICMR, I chair, and here we have two co-chairs, one representing science organizations and one the policy side. And this science and technology task force is banned science organization. So it is DST, DBT, Atomic Energy, Defense Research Organization, DBT, and CISR. So it is a conglomerate of all the science agencies, including ICMR. And this is where the thrust for vaccines, thrust for new medicines, thrust for diagnostics, thrust for PPE, these disinfection chambers, washing N95 masks. So all the technologies are being looked at by different verticals, different organizations, but they're all brought together as helping each other and also promoting each other. This is also the forum where we are reaching out to the startups for the innovation architecture of India. And in a systematic way, the startup ideas are filtered and then taken for further consideration. We get them connected to funding resources, to laboratories, to industry, and so on and so forth. So these are three: science and technology, clinical, technical, verticals that have been created. Then, of course, individual institutions are working together. One of the outputs of this kind of a work is also how we should share the clinical samples and virological samples across laboratories. Say a virus sample is needed by a certain laboratory for making a vaccine candidate. So how is it to be shared? The guidelines have been created. If a researcher needs blood samples from clinical patients, what are the guidelines to follow? This is being done, and now we're looking at how to use the PM CARES fund for vaccine development. We're looking at how to facilitate the industry to come out with the vaccine pathways, whether they are doing their own or they are doing it in collaboration with others. So there is a lot of macro level work that's being done, and this is the broad paradigm, and there is a very strong connect with the state governments, and that reach out is very, very critical and very effectively being done.
So wonderful, sir. I think you have maintained a lot of coordination. I can see a lot of parallel things going on simultaneously. So similar to this question is, every day, everybody is amused that what will happen now, because the guidelines are changing almost every day. And every day, then whenever there is a new lockdown, so everybody sees what will happen now. So how do you maintain this balancing act between science on one side and economy related priorities on other side, and while ensuring that there is no panic among the population?
Well, as I said, this is perhaps the most important task and responsibility, and a critical area to be mindful of for the entire government and entire society. Because you're trying to balance control of a pandemic about which we do not know many things or most things in a way. There is no rule book, there is no previous experience, there is no SOP that should be followed. Every country at the macro level is doing things for the first time. Unprecedented things have happened. This is only an animal in the zoo, which is only 100 odd days old. This thing did not exist on the planet, at least as we know it. So it is totally new, and all countries are grappling with the question that you raised. How do you make sure that you suppress the chain of transmission, and at the same time you do make sure that the life goes on? The point is to be able to balance saving lives with saving activities and normal life. And it's a difficult balance, because the point is that in this battle, we do not have a drug which changes my susceptibility. We don't have a vaccine which changes the susceptibility of individuals. So everybody is susceptible to this virus. because practically everybody has no innate immunity or the acquired immunity to protect against the onslaught. So virus is moving in a very, very safe environment, so to say, and has so many people to infect. And how the epidemic pans out depends on what we do together.
Yeah.
So virus is doing its job. Virus knows its maths, its capabilities, and it will catch susceptible people once it goes close to them. But the shape of the trajectory and the shape of the pandemic and the size of the pandemic is not the will of the virus alone. We create the headwinds to stop the virus by doing things even without a drug and without a vaccine.
Yeah.
And we do that through the best practices that you're discussing today, whether these best practices are distancing, mask, hygiene, or whether using, Arogya Setu app to be mindful and to behave in a certain way, or to look after old people, or to care seek when the time comes, or to contain. So all the actions that we do,
absolutely,
from what is available to us as best practices, is what decides how much we are able to stop the virus.
Exactly.
And create headwinds so that it doesn't go forward. And so therefore, there is no way to know how exactly this whole pandemic will pan out, because virus part is predictable on many models. But what we do collectively, 1,300 million of us, 1.3 billion of us, cannot be factored into a mathematical equation. It is us as individuals, us as families, communities, as society, as state, as a city, that would determine where it goes. So there are imponderables. But one thing is very clear, that the virus is there to stay. We do know the vaccine is away at least more than a year, if not longer, if at all it comes, and so on. So we have to accept this. It has created a havoc in the country, on the world, in more than one way, most unexpected. But that's the way forward, and that has worked in different states. Many states have been able to flatten the curve. Punjab is one of them. Kerala was one. Now they have a little blip, but they were successful. And so there are others also quite close to that in a way. And overall also, we have slowed down the transmission from doubling every 4 days or less to 14 days or more. So there are achievements that have accrued to us as a nation by creating headwinds to the transmission and the flow and the journey of the virus. And we will continue to do so even as we prepare our health system.
So, sir, similar question in continuation with this, because you have maintained a very nice balanced act, and despite maintaining a good balanced act, India has fared far better than many other countries across the globe. So, whom do you want to give credit to in such situation?
Well, credit goes to the Honorable Prime Minister first and foremost, but the credit also immediately goes to the people of India as a nation. It is the country as a whole which has followed the decisions that were taken, welcomed them, accepted the cost that occurred. Unfortunately, that cost to the economy is there. Human cost has been there. But yes, the country has stood clearly together. And there was a consensus, there is a consensus, there continues to be a consensus that this calibrated response was the best way forward, coming at a time when we were not having many deaths. So we could save lives, unlike other people who took such steps when lives are already costed much more. So it was a strategic decision. People welcomed it. All the state governments welcomed it. All the chief ministers welcomed it. They have stood by the strategy. And now when we are easing out this in a systematic way, we are more ready than ever. We have demonstrated our behavior change more than ever. Our science is better prepared now than before. And our resolve is there ever before. And we will face it and have a strategy in which there will be containment of of relatively smaller areas, and we hope to normalize the life outside these areas to the best possible extent in a gradual, calibrated way.
So hope to get better, hope to neutralize it, hope to, I think we have a lot of hopes, and it can be believed because we have done all the good for last 100 days. So sir, another question which I have asked also to Dr. Randeep is about every stakeholder, whether it is AIMS, ICMR, NCDC, or even different states, may have contrasting opinions about lockdown, about curfew, about different aspects of COVID management. You being at the hot seat, how do you ensure that flexible approach while consolidating all the views of different people and convince them?
The Honorable Prime Minister has made sure that his decisions are well thought out, well planned. He's made sure that there is a total and full engagement with the state. So there is a consensus on the approach that has been taken so far. There is no doubt. It is a unanimous and full consensual approach through which the country has moved forward. Now that we are moving to the next phase of this battle, there is a consensus that it's time to open up, time to face it, time to respond through the health system if required to look after exposed patients, sick patients. And if need be, the strategy will be further refined.
Yeah.
So I would say the strategy so far is truly national in character, based on consensus, based on a collective judgment of its being relevant to the existing circumstances. And this is how we will move forward as a nation.
Good, sir. So a final question is, like, we have decision makers of 161 ITEC nation who are listening to this program, and they want to know two things. One is, how do we anticipate the future? So everybody is looking after the future, what the future is. And second is, what one advice you'd like to give to them so as to contain the coronavirus in their country?
Well, nobody knows the future. I wish the future was known. Nobody predicted this pandemic. Nobody thought this will be so devastating. So I think we should not pretend that we know the future. We can say science helps us to peer into what may look like future. These models are available which do indicate certain direction, but none of the model is perfect at all, and there are huge variations in any predictions that anybody has made. There's a wide range of uncertainty. So I don't think future in that sense is predictable. But one thing is predictable, that this virus will live with us for some time, if not for a very long time. There is that there is a journey of at least a few months, if not longer, of intense fight with the virus. Kind of things that we were discussing earlier. That is for sure certain. It has changed our lives, that is for sure. We will have to continue exhibiting the new normal, that is for sure. But beyond that, it is not easy to predict, because we don't know the disease. And as I said, the most unknown is how good our collective response is, because that determines the trajectory and that determines the damage. And we have no way to put that into an equation. And therefore, I would not predict future. My only request on this global forum will be that we should use opportunity to learn together, to share experiences together, share science and technology products together. We should look at how we can be most helpful to the most vulnerable, to the most poorest of the poor in this whole crisis. We are responsible to make sure that the damage is minimum and the poor people suffer the very least. And our collective endeavor for solutions, which are drug solutions, diagnostic solutions, as well as vaccine solutions, should be attempted together and should be shared together at an affordable cost. And that is how we as humanity can face this unforeseen, unprecedented challenge to all of us. Thank you.
So sharing is the key, and because the virus knows no boundaries, so that is the message. So thank you very much, sir. Thank you for joining despite your busy schedule. And I hope that we'll keep on listening from you, and India will really fight this battle head on.
Thank you so much, sir. Thank you.
So I'll come back to Dr. Nagendra. Dr. Nagendra was there, and we have few questions which were raised by our audience, is about what should be the model of integrated healthcare in medical institutes of SAARC and other countries.
Yeah, first of all, I was very thrilled to see how our, Dr. Paul has been able to bring about the dimensions that are emerging in the big crisis that we have. And rightly have been asking that the time has come as to how we have to integrate the Ayush systems in general, along with the modern medical treatment modalities and also preventive measures to tackle this challenge. As you have heard from Prime Minister again and again, that we have to see that we bring the tradition also into fore to see whether we can emerge with a more satisfactory dimension into the whole thing. And in the field of yoga, we have been working. And one of the main things that we had to do is, apart from social distancing and washing of the hands, and also the other things that are very necessary, which has to be followed, the yoga dimensions build up the immunity. As rightly Paul was mentioning, that we don't have any vaccine or the medicines to deal with it. Therefore, the possibility is that we have a chance to increase our immunity system and see that we grow very strong in our immune. Fortunately, our WBCs are much bigger than the coronavirus, is only 0.25 microns, and WBC is more than 2.5, more than 100 times. And the number of WBCs also very large. So easily it can take it, unless it is made very weak by the wrong lifestyle. Too much of stress, anxiety, and fear, and other things. If you bring that, it's going to weaken. As you know, stress is an immunosuppressant factor. And when you weaken that, you are prone to become more succumb to the virus attack. And this is what we have to do. So sitting in the houses and the lockdown in places, there's a great opportunity for people to spend time for the yoga. Therefore, we developed very simple modules of yoga which can be used to develop. And we did a lot of research to show how the immune system can be improved on all fronts. And we had a lot of research papers, and we have published to show on various conditions the immune system can be developed in the diabetes, in cancer, and several other NCDs we have done. So this is what we want to adopt. So this is the dimension to be added on into our modern medical system. That's how integration should come. Similarly, the paradigm shift that is needed with Ayush and yoga is a consciousness-based approach in contrast to matter-based thing. Looking at man only at the physical level is one aspect which has brought dividends for us, no doubt. It has been wonderful. But at the same time, the higher dimensions of human life has to be put into practice. Prana, the mind, emotions, intellect, and all these things have to be brought forth to bring in the integration. This is what we have been trying to do for the last 40 years, bring in this dimension to see that we have a good integration. And that's what is working. And we hope that this will also apply for the present crisis. And we have already having a lot of thousands of people who have been able to use yoga on various fronts. And also recently the Ministry of Ayush also has given the mandates as to what Ayush, the Ayurveda medicines and other can be used for this thing. If it is adopted, I think it will be a good adjunct to the present thing. And instead of saying that only we are going to do only the physical thing, and we don't have any medicine or vaccine, we should add on and try out many of the Ayush, Ayurveda, Siddha, Unani, homeopathy system, which have shown to bring the immune system better. And among them, yoga is the easiest. It has no secondary effects and is very cost effective and can be done. And that is the whole approach that we are taking in integration.
So thank you, sir. I think you have very nicely put out integration model, how integration model works. So sir, since COVID has come, I think India, everybody is looking at India because India is the pioneer of yoga. So can India mentor all these ITEC nations, especially the SAARC countries, for managing COVID as envisioned by our Honorable Prime Minister?
Yeah, the Honorable Prime Minister has been responsible for bringing yoga to all over the world and through the International Day of Yoga. It was then he said that what is the simple module that can be developed for this thing? And we developed a simple 35 minutes integrated yoga module, and which has become very popular around the globe. And particularly the present thing also with the CCRYN and Ministry of Ayush, we have been able to develop this yoga module with the help of all the yoga masters, and these things have been put. The key thing is, principle is deep relaxation to the system by relaxation techniques and slowing down of the breath, reducing the metabolic rate and calming down of the mind to bring the peace, harmony, love and others. So by these three factors, which are brought forth by asana, pranayama and meditation, we will be able to bring about very strong immune system. And this is how we can use this dimension. Yet another dimension that we started is to bring about a change in the global consciousness field. We developed what is called as the synchronized global prayers. And in the end, we have a distinct sankalpa that with the help, with the power of silence, with the collective power of silence, we'll be able to increase our immune system. And we had a number of programs with all the yoga masters, and several lakhs of people participated and brought forth. And our Prime Minister thing to just clap also had a big effect. And such things will increase the positivity, which can help in developing the immune system. Such methods also should be thought of, out of the box things, so that we'll be able to develop the integrative system into the whole encounter.
Rightly said. I think it's COVID has bring us the opportunity, and especially for yoga. Yoga has already been in forefront, but again, COVID has bring yoga into even further forward to actually tackle the disease, not only by developing the immune system, but also developing a sort of an inherent sense of cohesion within us, so that people can better mentor and people can better tackle the COVID in a big way. So thank you, sir. Thank you for your time. And I think it was a pleasure listening from you. Every time we listen from you, it's always a big pleasure.
Thank you very much. We also congratulate your director who has been spearheading. And I hope soon the Integrative Research Center will also come up in PGI there, just like we brought out in AIMS. Last time when I came there, I had a good talk with him. And then I talked to our Harshvardhan ji, the Honorable Minister for Health. He is also very keen it should come. And we should all take initiative, and this is the right time that we can add on the dimension of yoga and the dimension into very premier institute of Chandigarh that you all are in. Once again, I congratulate you for your wonderful coordinatorship and doing this so nicely. I really appreciate you. Thank you very much.
For sure, sir. I think we'll like to build the collaborations between the modern medicine and yoga in a big way. So thank you, sir.
Thank you very much.
So we have with us another Secretary General of Indian Public Health Association, Dr. Sanghamitra Ghosh. So she is the Secretary General of Indian Public Health Association, who has having a membership of over 15,000, served as Chief Medical Officer in Ministry of Defense, and got a prestigious award, Indian Medical Association's Dr. Kanak Goyal Award for his commendable work in family planning and health work in 2014. She has got immense experience in the field of gynecology and actively involved in the field of public health for so many years. She has got lot number of publications in national as well as international journals. So, madam, you have been a Secretary General for 2 tenures now of a association which is the longest, the largest association of public health, not only in India but also abroad. So, how do you have ensured that your association has played a dominant role in managing Corona?
Thank you, Dr. Sanu. First of all, namaste to all. I heard all of your lectures and all discussion in this forum, and it is marvelous. We have heard Dr. V.K. Pal. So about your question for our association, you know, our association has unique membership criteria that not only the doctors, we have nursing officers and social worker, health workers, they are also our members. So all these members in other states, they are working for the corona prevention. First of all, from the headquarters, we have been invited from PM PMO and in Niti Aayog for participation in the policy making of the COVID-19 prevention. And the meetings virtual, and it was attended by our president, Dr. Sanjay Rai. And we are in the policy making, we are with the government, and we are doing the awareness program, and we are increasing the capacity building. That capacity building is our main aim now. And for that, we have first in 17th March, we gave a public advisory for all the public and for our members for the COVID-19 prevention. And there only we first mentioned that this is not social distancing, it is physical distancing. And we gave 3 points. For one is that cough etiquette, second is social distancing, and third is source containment. And after that, we have changed our public advisory as and when, as sir has said, that we don't know about this virus. Every day we are gaining knowledge about this virus, and it has played havoc in all the countries. So in here also, we are gaining knowledge, and all the prediction models are not proving true, makes maximum time. So we also had some mathematical prediction model, but that is not proving true. But we have gained some time with the government's lockdown, that we certainly we increase the infrastructure, health infrastructure, betterment of the health infrastructure, and we are with the government. Like government has asked for members list from the different state, that we have sent already, because we have members in all the states. Our members in different states, they are working as state level nodal officer, senior nodal officers, and our different public health leaders, they are working with the central team in different state. Like we can you must be knowing that NICED means National Institute of Enteric and Cholera and Enteric Disease, and then All India Institute of Hygiene and Public Health, all the professor and professor director, they have been selected, and they are going to different state to see the epidemic state, and is there any gap.
Yeah.
So,
yeah. So, Dr. Sangmitra, I think a lot of things have been done. You have really highlighted that association has played a very dominant role in managing the corona and in real coordination with center and various states. So, the similar question to this is, how have you ensured linkages at different levels, and how do you perceive the change role of association in the future?
Obviously, this is mostly virtual, always. And in our state level, in our headquarter level also, our headquarter staffs are working from home, and we are also, some of them are working from home. And we are going to publish one of the COVID-19 special issue for our journal. So all our meetings are virtual. Somebody is in Delhi, somebody is in Maharashtra, Pune, Mumbai, and everywhere. Even our publisher is Mumbai. So we are always in virtual and in the social media. And actually, I have given so many interviews, all from my home to the BBC, to Akashvani radio, and to all of the TV channels. So these are all virtual, and we are connected with all our members from our website and online only.
Wonderful. So I think IPHA is playing, like IAPSM has, IPHA and IAPSM are both public health associations playing a very dominant role in this COVID era. And I hope that they will continue playing the similar role, and they will have an even bigger role in the future if the corona pandemic strikes them.
Obviously, because our scientist members, they are in the testing and the vaccine, in the virology lab, and in the vaccine development. So we hope that a future vaccine will come, because we will live with this virus mostly. And the peak will come in different state in different time. We for this year will be like this, and all our conferences and all the everything will be virtual. Probably the national conference also. And we are connected with our World Federation of Public Health, which we are the member. And the World Federation, you know very well that the World Federation conference was is in October in Rome, going to be held in Rome, but it is cancelled and it will be a virtual conference. So it is a new normal thing.
New normal. Okay, thank you, Dr. Sangmitra. I think thank you for your kind words, and I hope that I am saying that public health associations should play a dominant role in this corona pandemic. So
thank you, Dr. Sanu.
So our health minister of Bihar, so he has just conveyed inability because he is in some other meeting with our Honorable Prime Minister. So I will just go to Dr. Rakesh Gupta, who is a President and Director Public Health of Strategic Institute of Public Health Education and Research. So it's a non-governmental organization. He was a Director of Health Services and Director of Chemical Examination Lab, Punjab, an alumni of Johns Hopkins, Baltimore, and University of California, San Francisco. He has won several awards, including WHO Award 2015 on World No Tobacco Day. And besides, he has represented Ministry of Health and Family Welfare for various consultations on tobacco control. So, sir, welcome to this forum. And I would like to ask from you is how an NGOs or a non-governmental organization or an institute can play a big role in a COVID-19 epidemic, and what role the CIPHER has played in managing the COVID-19 or helping the state or the national government.
First of all, thank you, Dr. Sonu, for calling me. And good afternoon, all the panelists and the participants. So on call of CEO of Niti Aayog, the NGOs have been playing a very positive role. But though I must say that in India, the political leadership, the bureaucratic leadership, and our health administrators, they have been leading from the front. But still, NGOs have been playing their part. They have been providing physical and human resources, and they have been identifying hotspot, deputing volunteers and caregivers to deliver services to the elderly and other vulnerable groups. They have been also creating awareness about prevention, social distancing, isolation, and combating stigma, which is very important. And they have also been providing shelter to homeless, daily wage workers, urban poor families, and they have been providing kitchens for the community kitchens for the migrants. So ours is actually public health NGO, and we have been creating awareness about the comorbidities, especially the NCDs, use of tobacco in any form and other addictions. So along with the School of Public Health, we have done a lot of consultations, webinars, as physical conferences have not been able, are not possible these days. So we have been doing webinars. We had a state level workshop for awareness of hypertension amongst the media people. As you know, the media people, they are very stressed out. They have to work late hours. And to our surprise, almost 50% of the patients of the media people, they had hypertension. So after that, we had a webinar on tobacco, nicotine use, and COVID-19. As we are all aware that tobacco in any form can, with the chance of infection is more, and the outcome is also bad if one is tobacco users. Fortunately, Indian government, they banned sale of tobacco and also spitting. And the spitting, as you know, it creates infection. And it is good that spitting has been banned, and most of the states, they are in fact implementing the ban. And after that, we had a webinar on hypertension and COVID-19, role of yoga and management. So we had a faculty from Dr. Nagendra's Institute, SVIASA, and we had a very good interaction. And in fact, I must say that I started doing yoga after that webinar. So that has it has done a positive thing for me also. I am hypertensive, and I have started doing yoga after that. And then we had a seminar on tobacco cessation. So as you know, the pandemic, since there's availability of tobacco is not there and the spitting is banned. So it is a need and an opportunity to provide cessation services to the people who are addicted to tobacco. So it was very well attended webinar, and we had almost 100 people in that webinar. And yesterday we celebrated World Hypertension Day on a virtual platform. And Honorable Health Minister Punjab was with us. And there was a release of e-newsletter, which has been created by PGI. Actually, Dr. Sonu Goyal is spearheading that project. And there was e-release of cardio health. So as we know, hypertension is the main risk factor and the most important comorbidity for the COVID. We have been doing our role, and we are also participating with the National Health Mission for providing telemedicine services in the health wellness centers. We have recently provided some dongles, the Wi-Fi dongles and the SIMs to the CHOs, so that they are well connected with the telemedicine hub. And we also actually gave some gowns, masks, gloves to the needy people. I mean, our health professionals in hotspots. So this is what we have been doing.
So wonderful, sir. I think as an institute, a non-governmental institute, a non-governmental organization, you have played a good role, not only in raising the awareness of the people, but also in helping the state in implementation, doing advocacy work, and also helping the poor people in getting the things which they are deprived of. So I think you have played a very dominant role, and your organization is playing a dominant role in all these activities. I congratulate you for these things.
Thank you, Dr. Goyal, and PGI has been a big support for us.
Thank you. So now this is the time to end our panel discussion. So it was a very lively panel discussion with experts ranging from a field of yoga to non-governmental organization to our professional association, from policy think tanks, from implementation, and all the aspects under one roof. And we have not seen such panel discussion before, in which all the people have been collected under one roof. And I really thank our experts, namely Dr. V.K. Paul, member Niti Aayog, Dr. Randeep Guleria, Director AIMS New Delhi, Madam Vinny Mahajan, Additional Chief Secretary, Department of Housing and Urban Development, Government of Punjab, Dr. Harshad Thakur, Director of National Institute of Health and Family Welfare, Dr. A.M. Kadri, Secretary General of Indian Association of Preventive and Social Medicine, Dr. Sanghamitra Ghosh, Secretary General of Indian Public Health Association, Dr. Rakesh Gupta, President Director, Public Health, Strategic Institute of Public Health Education and Research, and our Dr. H.R. Nagendra, Chancellor of SVIASA, a yoga guru. And I want to mention special thanks to our Director, Postgraduate Institute of Medical Education and Research, Professor Jagatram, who has given all these motivation to conduct these webinars and design these webinars for Ministry of External Affairs, Government of India under ITEC scheme. And this has really been very useful for them. We have been getting very wonderful feedback, and we have trained 140 people in these two last webinar series, which contained 28 lecturites and panel discussion with experts. So I think this has come in a big way, and there has been a request for such sort of webinars in future for all these countries. So I really want to thank our eminent experts who have spared that valuable time in this unprecedented corona pandemic. I also want to thank our people or the senior level decision makers from different countries who have participated in this webinar. And I really hope that this panel discussion will go a long way in mitigating the corona pandemic in their own countries, and they will really go learned by the expert advices of all the eminent experts through this panel discussion. So again, thank you very much for part of this panel discussion. And I hand over this thing for the next part of the session to Dr. Kritika.
Thank you very much, sir. I would sincerely thank all the panelists for the successful completion of this panel discussion. It was really an interesting session, and the rich experience sharing by the resource faculty from different fields was actually important and has led to grown our horizon. So I'm really thankful. So before we move to the end of this panel discussion, I would like to share the movie which was created by our alumni of International Public Health Management Development Program, that is Front the Dedication. So we'll be showing you a movie, a short movie, which is just of 7 to 10 minutes. And then we'll display a message by Ministry of External Affairs. Thank you.
ये धैर्य और अनुशासन की घड़ी है। जब तक देश में लॉकडाउन की स्थिति है, हमें अपना संकल्प निभाना है, अपना वचन निभाना है। मेरी आपसे हाथ जोड़ करके प्रार्थना है कि घरों में रहते हुए आप उन लोगों के बारे में सोचिए, उनके लिए मंगल कामना करिए जो अपना कर्तव्य निभाने के लिए खुद को खतरे में डालकर काम कर रहे हैं। उन डॉक्टर्स, उन नर्सेस, पैरामेडिकल स्टाफ, पैथोलॉजिस्ट, उनके बारे में सोचिए जो इस महामारी से एक एक जीवन को बचाने के लिए दिन रात अस्पताल में काम कर रहे हैं।
Namaste. As we are aware that we are facing an unprecedented and challenging situation of COVID pandemic, in these difficult times, we all need to come together and defeat this pandemic. Through this video, the alumni of International Public Health Management Development Program, the course which is sponsored by Ministry of External Affairs, Government of India, under ITEC scheme, have provided a solidarity message to all of us across the world to be together and be safe.
تحياتي لكم من فلسطين مع انتشار مرض كوفيد 19 في كل انحاء العالم. بنحب نحكي لكم جميعا الرجاء البقاء في بيوتكم حفاظا عليكم من اجل سلامتكم وصحتكم جميعا. Please stay at home. لبنان صباح الصدر from Palestine.
عشان نقدر نقضي على الفيروس من فضلك خليك في البيت.
Boloka Marcelo Namulabi.
من فضلك خليك في البيت. فولنا مهم سرتنا ترنجيجانتي في دينا فلنا في تيدي في تلنا تشانا عرفنا رانا طول ما كريجو من في تجربة كان كم ما كيف هسكينة تجارية دنيتنا تشانا.
سلام، من ضیاءالحق هستم از افغانستان. برای سلامتی خود و دیگران در خانه بمانید.
Corona roge obasitanawata kada bayanakයි. Ente apa jayagata yutumai. Karunakara niwasema rendi sitinna.
Kwa majina naitwa Judith Pute, mimi ni mhudumu wa afya nchini Kenya. Ningependa kuhamasisha kwamba njia ambayo imethibitishwa kuzuia uenezaji wa virusi vya corona kwa asilimia kubwa ni kwa kukaa nyumbani. Tafadhali ndugu zangu, zingatieni hayo na maagizo mengine yoyote yenye yanatolewa na serikali.
من غاية من الكورونا عشانك وعشان أهلك وعشان أحبابك خليك في البيت، اقعد في البيت، صبها في البيت.
Betul bahasa Semang bincang dan bahasa Corona khususnya yang mana apabila disyarakat oleh apa yang perlu khususnya
This is Lovely reporting from city of Asaba, Delta State, Nigeria. Please stay home and don't make up the statistics while we stay at home for you people. God bless everyone.
عشان صحتك وعشان صحة اللي بتحبهم اقعدوا في البيت عشان نحافظ على صحتنا ونعدي من الأزمة دي على خير.
I am Angelina Rampasad from Trinidad and Tobago. We are all facing a global health crisis with COVID-19 pandemic that many of us would not have imagined in our lifetime. We are fighting for survival against an enemy that we cannot see. Already 1.2 million men, women, and children have been infected with this deadly virus, and unfortunately 70,000 plus have lost their lives as a result of this virus. As medical professionals and frontline workers stand in the gap for communities, region, and the world, they are administering care that has nursed over 272,000 persons back to recovery. Let us all remember to practice our social responsibility in this fight. Wash your hands regularly, cover your nose and mouth with a mask, avoid close contact with others, stay home, stay safe, save lives. As we move forward together, let us, as Ephesians 4 verse 3 says, make every effort to keep the unity of the Spirit through the bond of peace.
Hola, soy Víctor Díaz y desde Chile te pedimos que te quedes en casa. Cuidémonos todos.
Coronavirus, Khalik Debate.
My name is Dr. Darren Dukiram, and I am a specialist in emergency medicine and president of the Trinidad and Tobago Medical Association. COVID-19 has had a significant impact on health systems worldwide, and it is imperative that we all obey simple rules in terms of personal hygiene, social distancing, and most importantly, staying at home unless absolutely necessary. It is a group effort to flatten the curve so that our species will survive. Thanking you from Trinidad and Tobago. This is again Dr. Darren Dukiram.
Quédate en casa.
Together we can fight COVID-19. Please be responsible. Stay home. Stay home, save lives.
Jama'a barkanmu da warhaka. Wannan tunatarwa ne game da wannan annoba ta COVID-19 da muke fama da ita. Mu kare kanmu da 'yan uwanmu mu zauna a gida.
Habari, naitwa Dr. Joseph Mutsia kutoka Tanzania. Corona ipo. Kwa salama, tulia nyumbani. Asante.
Hola, soy María Belén de Paraguay y te pido para que te quedes en tu casa. Eputan de robar.
نلتزم في بيوتنا من أجل سلامتنا وسلامة مجتمعنا.
Namaste. I am Dr. Geeta Ramsundar Rajkumar from Trinidad and Tobago. The time has come for all of humanity to unite. Against COVID-19, together we must fight.
नमस्कार, मेरा नाम डॉक्टर कृतिका उपाध्याय है। मैं डिपार्टमेंट ऑफ कम्युनिटी मेडिसिन एंड स्कूल ऑफ पब्लिक हेल्थ, पोस्ट ग्रेजुएट इंस्टीट्यूट ऑफ मेडिकल एजुकेशन एंड रिसर्च, चंडीगढ़ से आप सभी से ये आग्रह करती हूँ कि आप घर पे रहें, सुरक्षित रहें और स्वस्थ रहें। अगर हम सब ये मिलके करेंगे तो हम इस महामारी से मिलके लड़ सकते हैं और जीत सकते हैं। Stay home, stay safe.
Thank you very much. I really appreciate the alumni of IPHMDP who had contributed to make this video and sharing the message that staying at home can actually prevent your family, your friends. So I thank everybody. So moving further, I would like our team to display a video message by Mr. T.S. Trimurti, who is Secretary Economic Relations, Ministry of External Affairs, Government of India. As he couldn't join us online, so he has delivered his message through a recorded video message. I request our team to please play it.
Good evening to you all and to all Corona warriors. It is my pleasure to see such a large number of participants for our COVID management ITEC program. Your presence showcases our sense of cooperation and collaboration in combating this pandemic together. I would like to thank all of you for participating as well as contributing positively to this exchange of ideas and best practices. India has been reaching out to countries and assisting them in this very difficult period. We are truly grateful for the appreciation that we have received. As Ministry of External Affairs, we are very happy to be implementing Prime Minister Modi's vision of connecting and collaborating in this time of crisis and uncertainty. We hope that the interactions started during this program will be kept alive to assist our region's healthcare community in finding effective protocols and solutions. I would also like to thank our Indian institutes, AIMS Raipur, PGIMER Chandigarh, and AIMS Bhubaneswar for organizing an effective series of webinars on relevant and appropriate topics. Most importantly, we at the Ministry of External Affairs appreciate all our doctors and healthcare professionals who have taken time out to engage in robust knowledge sharing in these sessions. We will be continuing our COVID management ITEC courses and hope to see more of you to participate and benefit from these webinars. Dear ITEC participants and healthcare professionals, please accept our thanks and best wishes.
Thank you very much. Thank you, sir, for delivering your message, though he couldn't join us, but we thank him for taking out time and recording this message for our global participants. So the time has come that this webinar series is ending and this is the last time. But still, I hope we'll stay connected through our social media pages. I request you to please follow us on Twitter, on our Facebook account. For Facebook, you can send us request on IPHMDP PGIMER. You can follow us on our page, that is International Public Health Management Development Program. And also, you can Twitter us at @IPHMDP. So before I say you goodbye, I request you to please give your feedback for this panel discussion. Our team will be sharing the link in the chat box and you can just click on the link and please give your feedback. I also request the participants to give the feedback to Ministry of External Affairs that you can do from your own portal by adding your own credentials. So your feedback matters. So we'll be closing this session after another 5 to 7 minutes. So I'm waiting for your feedback. Thank you. So, dear friends, time is here to say goodbye and to end this panel discussion. So I'm very thankful to the participants who have actually joined this and have been continuously watching us. And also our director, Professor Jagat Ram, for giving time from his busy schedule, and all the facilitators and the associated teams who are working hard for this panel discussion and the overall webinar series, and had made this event actually a success. So I would say goodbye and stay connected, stay safe. Namaste. Bye-bye.